Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. We are pleased to welcome back Dr. Deepa Verma, a double board certified physician in family medicine and integrative anti-aging medicine practicing in Tampa Bay, Florida. Welcome back to the show, Dr. Verma.
Thanks, Lindsay. Thanks for having me.
You last spoke with us in 2018 and you shared your story of becoming an integrative medical physician. A whole lot has happened since then. Will you provide us with some highlights of what you and your practice have been up to in the past 3 years?
Absolutely. So it's pretty much exponentially grown. Every year was just getting better and better. I feel there's such a need for integrative preventative medicine. Just in the past year, I've opened up my second location. So I've had my Clearwater location for about 8 years, and I just recently opened up in South Tampa. And my goal is to expand another 3 to 4 offices in the next couple of years.
Congratulations.
Thank you.
What advice would you give to your colleagues who are either considering starting their own private practice or who are having a challenging time managing an existing practice?
That's a great question, because after I do lectures with A4M or even other forums, I get inundated with emails asking how I did it, how I started it. I have a very unique practice. My integrative practice was really started from scratch, and it's such a potpourri. I mean, I do everything from in-depth consults to all types of lab testing you can imagine. I do physician-regulated nutraceuticals, I do IV therapy, medical marijuana, detox, weight loss. I have a CBAC pod, which is a hypobaric chamber, and then I added aesthetics into my practice. And I taught everything to myself from scratch. I really utilized my connections. Anyone who I knew, perhaps, who had visited me when I was a traditional family medicine doctor, I reached out back to them, and then one thing leads to another. I think there's a value in knowing things and how to use your resources. Being an MD is very challenging, of course, because you're in school forever. And as you know, in med school, you can actually get other degrees. You can get an MBA, a JD, a PhD, an MPH. You can do so many things. And I think at that time, when I was starting my practice, I thought to myself, like, should I have gotten an MBA? But I think one important thing is, if you really truly believe in yourself, there's something about saying, go with your gut instinct and follow your heart. I never saw challenges presented. And I started that practice, I don't know if you recall from that 3 years ago, but it was just such a challenging time in my life when I was getting divorced and my dad passed away, and it all happened within 6 months. And I knew I had to do something to get myself out of that, because I'm a very positive and spiritual person. And for me, directing my energy, I found my calling. It was innate, and that's when I created Synergistic, and that was when she was born. It was like a rebirth of my soul. And then from there, it just really, I had no fear. People would tell me, oh, you're just gonna not make any profit, for about 6 months, a year, 18 months. I didn't let that bother me. Within 3 months, word had spread, and it was all word of mouth. I didn't do any advertising. So I'm gonna tell any physician, we have to pay it forward, right? My goal and my passion is spreading the wealth of health. It's mass education. That's why I love doing these kind of lectures and these forums. And you can only do so much as an individual, and there's power in numbers. And if I can empower other physicians to do what I do, that just multiplies it and amplifies it, and we can get our message across even more. So I would tell all these physicians, do it. Don't just dip your feet into the water, jump in, because you're always going to regret not trying. And failure leads to success eventually. I think everybody goes in with the mindset like, oh, I'm not going to do well, and they're scared of the investment. I started from $0. I didn't take any loans or anything like that, and I just had faith, and I did the right things. And you have to make sure you know your area, the patients you're catering to. Look around you and see what services are being offered. I was very unique and one of a kind there, and sort of still am as an integrative MD, because a lot of physicians, and there's nothing wrong with that, they'll concentrate on a few things that they know how to do. If you're really good in aesthetics, you'll just do aesthetics. I have a potpourri of things. So it's like my hands are in different cookie jars. And I don't know if that's the best thing for everybody, but for me, it's unique. And people will come in, they'll do an in-depth consult, and I'm like, oh, you know what, can I get an IV therapy? Oh, do you have time for me to get some Botox? Oh, can I jump in the pod? There's so many things that you can offer. So I say just go, follow your heart. You don't really if there's no other opportunity than now. So I think it's something, and I would love to do a module like in practice management. I just get so many questions with that, but just to guide other physicians, because I think there's a lot of fear going into it.
You are leading 2 presentations at the IV Therapy Symposium taking place the week of this episode's recording. Will you provide us with some insight into the topic you are presenting on and why this topic is so important for clinicians to understand how you have incorporated this knowledge into your clinical strategies?
This is a very dear topic to me because IV therapy was something I actually taught myself from scratch. As a physician, as a resident going back, you don't really do much of that stuff. You always have nurses, starting IVs or drawing blood, etc. But I just love doing that. I'm very hands-on. And I literally started without knowing anything. I would buy the accessories to start the IV and kind of practice. And I had some great patients who ended up being in healthcare and nursing, and they would help guide me. But practice makes perfect. And I've done like thousands upon thousands of IVs, and the opportunity to also speak on IV therapy is huge. IV therapy is a very up and coming topic. It's been around for a bit. It got popularized by maybe some celebrities doing it, a quick pick me up or like a post hangover or something. But there's so much more to it. I think now when we focus on how we can optimize our health, how we can circumvent, bad gut health, IV therapy is the way to go. I think physicians need to know this is a very easy service they can offer in their practice. There's not much to the cost of it. You just have to have the knowledge about what you're offering. And IV therapy can treat everything from infections to autoimmune to energy levels to cancer. I'm going to be presenting on NAD specifically and the protocol with NAD, and then just presenting some patient cases. But because I'm an anti-aging physician, NAD has really come and made its mark because it's being used for preventative health, anti-aging, also used for mental disorders, addiction. I've had people flying from out of state and do like a 10-day course with me for NAD just to cure their narcotic addiction. It's pretty phenomenal. So I really want to bring this to light and help other physicians integrate these tools into their practice, because I think everybody, especially now during the pandemic, is looking for a quick way to heal themselves. And nobody really just wants to rely on the traditional therapies or pharmaceuticals. And IV therapies are very powerful because they bypass the gut. They deliver 100% of what you need into your bloodstream. So it's that education that I hope that will provide a lot of guidance, for physicians if they want to instill this in their practice.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show. And last question. Tell us, are there any particular habits or activities that you regularly fit into your schedule to stay grounded and keep yourself feeling healthy and whole?
Oh yeah, that's a great question. I'm all about mind, body, spirit, and that's what integrative medicine is. It's based on Ayurvedic medicine, and being Eastern Indian in origin, it's something that I've always been very interested in. And I am first generation, so I saw my parents doing things which are so popular now that nobody really knew back then, or I got made fun of, like yoga or drinking golden milk and things like that. I'm very much into preventative and being proactive. And unfortunately in America, our healthcare system is very reactive. You just kind of coast along during life, wait for something bad to happen and then try to fix it. And unfortunately by then it's too late. I want to be the role model to patients. I practice what I preach and preach what I practice. And there are not enough hours in the day. I'm an independent mother of 3 teenage boys. I'm running 2 locations, expanding my business, doing everything. And if I had 30 hours in a day, it would be great. But there are some very important things that I do for myself to keep me grounded. Meditation is one of them. Again, that's an ancient Indian practice, but it's something that we're seeing a lot now with yoga and mindfulness. I make sure the moment I wake up and during the day, and then when I go to sleep, I always meditate and I chant what we call mantras. And exercise fitness is huge for me. I feel like I'm still 20, and I think it's very good to keep your body fit, but it's your mind as well too. I have 4 pillars of a healthy lifestyle, and it's clean diet, exercise, restorative sleep, and stress reduction. So those are things that I do every single day to try to beat the aging process. And I think when you do that, you really feel fulfilled. And people ask me, like, when is the best you've ever felt? And I say, every day I wake up, I feel better than the day before. So it's almost like, oh my gosh, when's that day going to come where I can't say that? But I really do. I just want to optimize health. I want to, share my journey with people. It's not been an easy road for me, and I know a lot of people hasn't been an easy road. But I think if we can choose a few things every day that we do that's meaningful to us, that will keep us centered. And I think now, in the midst of this pandemic and all this craziness in the world, we need some stability. And we are in control of our health. And that's what I really tell my patients. It's your journey, and I'm here to guide you. But it's a journey to wellness of the mind, body, spirit, because it's kind of like having those 4 pillars are like 4 wheels on a car. They all have to be balanced, otherwise you're not going to really get anywhere. So those are the little secrets I like to tell people, and that's really what I offer in my practice, is addressing all those aspects.
Thank you so much, Dr. Verma, for spending your time with us today and sharing your insight and expertise. We truly appreciate you.
Thanks, Lindsay. I had a great time. Thank you.
And thank you to all of our listeners. Until next time.